All righty. Well, we'll keep rolling along. Again, welcome everyone to our first Learning Collaborative of the year. We really appreciate you for being here today and spending some time with us this morning and are very excited to introduce today's topic. So today we will be discussing pathways in behavioral health, the efforts to increase the workforce. So here at GHN, we have some specific initiatives around workforce development and recognize how big of a need there is in behavioral health in Washington State. So we are excited to learn more with all of you today on how we can participate in this important work. So a few of the things that we will be discussing today are the following learning outcomes. So we'll identify changes to the SUDP and SUDP-T credentialing process produced by Washington State Resolution 2501-103. We'll understand the current efforts by Washington State Department of Health to reduce wait times for all behavioral health credentialing. And we'll describe the strategies and tactics behind Washington State Healthcare Authority's Start Your Path campaign. So we are thrilled to welcome a robust agenda today with a just all-star team of presenters. I'm really thrilled to have representation from both the Department of Health and the Healthcare Authority. And this is the speaking order for today. So to kick us off, we have Claire Wilson and Eve Austin, both from the Office of Health Professions at Washington State Department of Health. And Claire is a dedicated professional in behavioral health with 12 years of experience in various agencies providing supportive housing, shelters, and diversion services, including 5 years as the director of the Snohomish County Diversion Center, where she led efforts to connect unhoused and addiction-impacted individuals with substance use treatment, recovery-based housing, medication-assisted treatment, and primary care support. In 2023, Claire took on the role of program manager for substance use disorder professionals and a new profession, behavioral health support specialists at the Washington State Department of Health. She appreciates the opportunity to engage with members of the workforce and support regulatory processes that uphold public health and well-being. Born and raised in Washington, Claire is deeply committed to improving access to behavioral health services across the state. In her free time, Claire enjoys making her own soap, cultivating an indoor jungle, and cohabitating with 2 cats who occasionally demand attention during virtual meetings. So wonderful to have Claire here, and Claire is joined by her colleague Eve. Eve Austin is dedicated to advancing behavioral health and supporting the well-being of marginalized communities and populations. Her passion for checklists and her commitment to people have driven her career due to her straightforward approach to removing barriers, creating valuable toolkits for her teams, and empowering talented individuals to achieve great things. With a combined total of 7 years of service at the Washington State Department of Social and Health Services and the Department of Health, as well as 6 years of experience in school districts and tribal health, Eve brings a diverse range of expertise to her current role. Outside of work, Eve enjoys spending the time with her 2 stepdaughters, as well as pursuing her love of reading and writing. For the past year, she has been enjoying bi-weekly Pilates, having finally found an exercise routine she can sustain long-term after years of searching. In support of her marriage, she often works on 3 classic sobs with her husband and hopes to avoid a 4th by the end of this presentation. She is also the proud guardian of a sassy black cat named Lulu, who occasionally reminds everyone of her presence in the virtual world. Born and raised in northern Minnesota, Eve has learned the resilience required to survive a Midwestern winter and has come to appreciate the milder climate of Washington. She has no intention of retiring in a cold environment and isn't hoping for snow to fall later this week. So with that, I will turn it over to my colleagues from the Department of Health. And I believe
Danny, is Eve able to get in? I think she's still in the waiting room. Are you able to see if you can let her in?
Let's see if that just let her in.
It did.
Danny, you can make one of us co-hosts.
There we
If you want to make one of us
go.
co-hosts too.
Um, So, Eve, are you planning to share your screen or would you like me to share my slides?
I am ready to go. You just say the word.
Okay, go ahead. I'm sorry you missed your lovely introduction. We all loved hearing about you. But I will go ahead and stop sharing and allow you to share.
Wonderful. Well, good morning, everyone. Just going to do a quick check to make sure that everyone can see my screen. Can someone give me a thumbs up really quick?
I'm not seeing it yet.
Not
Eve.
yet.
I don't see it either.
How about now?
Oh, we're in luck.
There you
Yay!
go.
Hey, technology is in our favor. All right. Well, good morning, everyone. My name is Eve Austin, and I am really glad to be here today to be able to have a conversation with you all. And really quick, just a little bit of housekeeping. We are going to use a new platform for some feedback because we would love to learn more from you, and it's called Slido. So in a few clicks, we'll talk a little bit more about that. But without further ado, I want to tell you a little bit about who we are. So I think you heard our introduction already, and I am joined with the subject matter expert, Claire Wilson, and I'll just let her say hello really briefly before we get started.
Very excited to be here today.
Thank you so much. So this is Slido, and I love bringing technology to a forum, and sometimes it goes well, sometimes it does not. So bear with me. But if you have a cell phone available and you're comfortable using it, you can use the QR code that is on the slide right now and scan it. It'll bring you to slido.com. If you don't wish to do that, you can go to slido.com, enter in pound 2353716, and it'll bring you to this prompt. What's really helpful for me when I'm presenting is really finding out how you interact with behavioral health in your community. And I know that Claire and I are so grateful for the work that you do. You support our local communities and our state. And again, that's why it's such an honor to be here. And I'm seeing provider, trainer, advocate. I love the word advocate. So thank you for whoever is adding these items here. Patient, beautiful, housing, awareness, again, trainer and advocate. Again, the word advocate means a lot to me because I've had several roles where I've ended up being an advocate for individuals in this marginalized population, and it means the world. Trainer, patient, love it. Infrequent, consumer, community expert, prevention, counseling. Well, thank you all for that feedback. That is unbelievably helpful for Claire and I as we continue our conversation to know how you engage in behavioral health. And we will talk more. We are really the regulators, and we've now become the credentialers, and we'll share a bit more. So without further ado, thank you for participating in that. We've got a couple more, so hold fast as we continue to go through that process. Well, the Office of Health Professions, where Claire and I work, really focuses in on regulation. We approximately have 78 different health professions ensuring individuals' practice in these fields meet specific education, training, and experience standards. And again, we'll be talking about how that credentialing piece ties in. And without further ado, why or where we started. So in January of 2023, some things started to unfold tied to credentialing. And we also were seeing a lot, we came out of the pandemic. There was a lot of different impacts hitting Washington, and we needed more behavioral health providers, as you well know. And your voices were heard. Legislators went into action, and there was a bill, House Bill 1724, that moved forward, and Governor Inslee ended up signing it. And in that bill really included several, I'll just say, the ability to be able to do some interfacing and supporting the behavioral health workforce. At that same time, there was also some concurrent things happening where we were noticing that credentialing was lagging behind. And we'll kind of share a little bit more about how the lens focused in on credentialing. So I'm not going to go over too much detail in this, but you can find House Bill 1724 if you want to find a little bit more background. But we've done the research for you, and it's all here. And there are specific sections in the bill, and we've highlighted those sections here. But the bill contains several changes across multiple professions to reduce barriers for applicants, reduce administrative burden, and the credentialing process. And the goal was really to increase retention and really support the behavioral health workforce. And you can let us know how it's working out as we continue this conversation. But the professions that were primarily impacted are listed below on the slide. I will just call out the substance use disorder professionals. We'll spend some more time talking about some of the interventions that occurred here, and then also our agency affiliated counselors. All right. So one of the key areas, again, I'll just kind of do a high overview of this information. You will have access, I believe, to all of our slides and the PowerPoint for more detailed information, but I'm going to highlight some. There are some key areas where the department must waive education, training, experience, and examination requirements. Oftentimes, we allowed people to test at an earlier stage for credentialing, which was really powerful to speed up credentialing timeframes for several of our individuals going through that process. Another area that ended up getting developed, and I kind of skipped over it, but 1724 also enabled us to address some of the barriers tied to out-of-state credentialing. We are now able to have a fast track process for individuals that are coming from a state that is substantially equivalent, and that has been a game changer. A lot of research went into looking at what states across the United States are substantially equivalent, and now you are able to move through that process faster. There's a lot of time and energy went into the agency affiliated counselor. There's now 3 tiers that I'm sure you are all very well aware. We ended up gaining the certification and license tier. We ended up also transitioning away from the MHP credential, which was causing some inconsistencies across how it was applied in the state of Washington. And now our licensed tier is really supporting that level for assessing and diagnosing. SUDPs, there's some really neat things that occurred with them. There was a lot of progressive work that happened. There was actually a subsequent bill, Senate Bill 16228, that came through that I hope you all are enjoying right now because it impacted fees. So now there is a cap of $100 that is now in place. And right now we are funded for this year, and we hope that we gain subsequent funding for this cap for SUDPs. And some of the other areas that I really want to spend in, licensed counselors got a lot of overhaul to really support some key items, as did SUDPs. Basically, all of our behavioral health professions went into rulemaking to make advancements. And that's a big overhaul and undertaking. And I'm really proud of the work that's been done. And again, my subject matter expert, Claire, is going to share some more of her heart and passion that she put into regulation. I don't know if she has shared, but she is coming directly from being in the field of behavioral health and really brought a new lens that we're really benefiting from. And I think there's a lot of common sense, practical implementations that are going to be coming to our new behavioral health support specialist role and also our SUDP role. This has also occurred with our agency affiliated counselor. Carmen Lesso is the program manager over that, and she has done a phenomenal job to reduce barriers and has additional plans over the next year to continue to refine and continue to improve how we can make things more straightforward. So impacts of 2023 at the end of 2023. So each behavioral health profession identified necessary steps to reduce barriers via rulemaking beginning in early 2024. And again, this is a large undertaking and you're involved in this process, and we want you even more involved in this process for future. So if you weren't engaged in some of this, I really highly shamelessly plug GovDelivery to really highlight the professions that you have interest in. You can select what you want to hear about. and you will get all the information tied to rulemaking, our process going from our CR 101 to 102 to 103. There's hearings that you can participate in, and it's invaluable to hear your voice in this process. That's one piece that I didn't understand for many years, of how important my voice was, to really bring some practical common sense to what you're dealing with and some of the barriers that are in place. And I will tell you that Claire and I have heard a lot, and we love hearing it again, because at the end of the day, hearing your voice helps us continue to petition and advocate for the right things. Sometimes it's a no, and sometimes it's a not right now, but we keep things on our radar, because ultimately our role is to implement rule. So for us, we are taking the cue from our legislators, and we have to do what they tell us to do. But ultimately, they also ask us at DOH, like, what is the pulse? What is happening? We have the opportunity to write reports of a summary of a significant analysis of what's going on in the community. And your feedback makes it to those significant analyses. So it's imperative that we continue this wonderful collaboration and bridge. And if you have questions about the process, I will say it's convoluted and it's complex and it can be intimidating. And Claire and I want to be the face where it's not so intimidating, because if you don't understand something, we want to take the time to meet with you, discuss, show you the resources where you can go to understand the full picture. And if that's still not making sense, set up some time with us. We welcome the opportunity to connect with you. And I know Claire has done some phenomenal things by getting out in the community, remaining after conference when she's had speaking engagements to really connect. And I do the same. And we really want to be able to support everyone in this process, to make it demystified. We don't want it to be a mysterious piece. And I love that a cat showed up, because mine is looking at me right now like she wants to just prance through the screen right now. And I'm giving her the look every 5 seconds, because our animals have made, I will say, my work life better. And then lastly, what I will be spending some more time on is the credentialing reorg. I'm going to keep moving kind of fast because I love to show off data. And that's what I am really hoping to do. But there is a huge overhaul. The Office of Health Professions was exclusively program. And what that means is we were in charge of regulating. We were not credentialing specialists. We worked closely with the Office of Customer Service, but we weren't. And last year in March, that all changed. And we ended up taking on 100 credentialing staff after a successful pilot that we'll spend some more time talking about. So again, we had some emergency rules that also went into place to make those permanent rule changes, because making changes to rule is a big process, and it's slow to allow change and to make sure that all voices are heard. Again, we talked about Senate Bill 6228, which brought the cap, and also some facility shifts as well that have improved the behavioral workforce. And we did gain funding to be able to do an overhaul of merging the Office of Customer Services credentialing staff with the Office of Health Professions. So I'm a flowchart girl. I need to see it laid out. I'm visual, forgive me. But this is the whole layout of kind of our credentialing merge. And one thing that I really like to start the conversation with is that this all started with a Seattle Times article about psychology credentialing timeframes being, I'll just say, not meeting the needs of the behavioral health world. And so the thing that I'm just going to shamelessly plug, it wasn't just psychologists, but somehow they were able to elevate it high enough. It was several. And I know that my credential has had some delays periodically throughout the process. And I think that that's something that we all feel. And I will tell you that there are leaders who are paying attention to this. We're monitoring, we're passionate about it. I hope that's what you get from me. I'm passionate about the work that I do and I love it. And I'm not done. And I know Claire's not done. And that's what I also hope you get, that you have people in the Department of Health that want to move. And I will say I'm a mover and a shaker. And I most definitely am excited about some of the things that are on our horizon for the future that I hope will improve even further. But you'll see some of the key pieces, all the things that came in the middle. And then where we ended up getting some proviso funding that resulted in us being able to merge and actually hire more staff for credentialing. Because as you all know, in behavioral health, if you have more staff to do the work, amazing things happen. And ultimately, that was our story too. The pandemic had drastically hit the credentialing teams, and they just didn't have the resources, ability to be able to support the credentialing process. And it had remained neglected for a long time. And that's ultimately, as an administrator, what I've done is I've tried to right size my teams, and you are going to see a lot of fruit in that. So I'm going to keep going because I want to make sure Claire gets enough time and you get to hear this amazing individual speak. But Project Pathway was created, and what it did is it really took one leader. It put very focused resources to focus in exclusively on psychology. What we found out is a lot of credentialing staff were working multiple professions. And I will tell you, psychology is a complex credentialing process. It is one of our most. And we were not allocating resources appropriately. And what we found was focusing in on culture and communication really created some profound impacts. Well, I will just say that the Project Pathway was so successful, and it was shared all the way to Governor Inslee. He's like, yeah, make it happen everywhere. And so it did. And so last March, that's what we ended up doing. We replicated the same playbook that went with Project Pathway, and we're living it right now. We're living the dream in my mind. I'm very happy about what has happened because a lot of the goals really were to focus on backlogs, really were to focus on what we found out. And I learned so much about credentialing, I had no idea. But I will say that the credentialing team is some of the most hardworking, compassionate people I have ever networked with. They're lovely. They're absolutely lovely. And I know several of you have talked with them. You've probably been frustrated with them, but just know that they are navigating a lot, and their productivity is something that we get data on. And I am proud of my team. They are working at 125% most days. And when they work at 80, I'm okay with that because they're pooped. But we are monitoring that feedback about the whole process. And what I honestly, I'm going to try to sum it up pretty simply, but when confronted with complex challenges, it's really crucial to identify the core values and principles that must guide our approach. I mean, for us, the answer was clear. We needed to allocate resources strategically and maintain laser focus on the ultimate goal. We really utilize data. I think Claire's tired of seeing a dashboard on a consistent basis, but that really helps make informed strategic decisions. Creating these models and then holding ourselves accountable. And I'm going to say camp on accountable for those key items, those goals. And then we relentlessly push forward. And have we encountered some barriers? Absolutely. You'll get to see them on some of our graphs, and I'll explain some of them. But we discovered that fostering an environment of innovation, psychological safety, and I love that word, so I'm going to say it one more time, psychological safety, and genuine appreciation for a job well done really is paramount. And I know I'm speaking to the choir on this. You all resonate on this and helping people get this heart, but a lot of it was really supporting the human capital in this conversation. We had extraordinary individuals wanting to do extraordinary things. And oftentimes we all need someone to really inspire us to keep going and to promote problem solving without saying no. So by strategically placing people in roles, we were able to empower and inspire and build these amazing goals that we are now meeting consistently to unlock the potential of this group. And so there is a human capital element. And I like to state that, especially to you, my peers, that this is something that works, and it works in productivity. It has to be there. I mean, the healthy work environments allow you to do things and then right sizing problems. And again, we have a broken system sometimes in many areas, and our goal is to fix that broken system to make sure that we staff it appropriately. So thanks for hearing my soapbox, but I really think people ask me like, how is it getting fixed? We're taking care of our people. That's how it's getting fixed. And I know that some of those themes will hopefully resonate for you. So data, something I love, but I get to show off what this is all about. So our intake in final approvals. So we actually have a dashboard that I'm not showing you because it's huge, but I'm going to highlight some of the key items for credentialing teams 7 and 10. Credentialing Team 7 is really where you're going to see your SUDPs, our CARs, our agency affiliated counselors, certified counselors, hypnotherapists. And then Credentialing Team 10 is going to see where you're going to have the licensed counselors and psychologists and SOTPs. So for our CARs, our agency affiliated counselors, one thing that I love is if you look at the center graph, it tells a very clear story. You're going to see very high numbers and then whoop, mischief has been managed. We are able to address intakes. And what we found out is we have two real pipelines with credentialing. One of which is really focusing in on when we have an application that's perfect and is completed fully, miracles can happen for us. We can do that fast. And that's our intake process. Where we struggle is when we need more information. And that's really where we're going to see our pending piece, and that normally requires email exchanges back and forth, and it can be dependent on the credential holder to send us information back. So that's oftentimes where we see more delays. So for pending, you will also see a dramatic drop, and then you'll start seeing it increase. And what that is as we got through intake so fast, there's some that didn't make it all the way through and they went into the pending, and then that increased. So the data in this graph really speaks to where we're at. And then when we transition over to final approvals, you're going to see that it just exponentially increases. And what that means is we do a triple check at the end of all of our credentialing work. And of course, this pipeline ended up getting saturated. It wasn't used to doing this level of approvals. And I will also say, as you'll note by the end of this graph, this is in August, we do something called vacation in state service. We believe in it, and people went on vacation. And it was not staffed right-sized appropriately. So now you get to see how we fixed problems in some of the incoming information. So again, this is really looking at how all of the professions within Credentialing Team 7 look. And you'll see some common trends. If I drew a trend line, bam, we are going in the right direction for all of these professions. And I apologize if I am boring you to tears because I really love data and I geek out on this stuff. So I do apologize. You are getting some of my excitement. I get to show off what this team did. But this is our current state. So this slide is actually from the 14th. This is the truth of where we're at with the intake process with Credentialing Team 7. So again, you see where we started this and where it's ended with CARs. You'll see that our agency affiliated counselors were in a really tough spot when we came in. And now we are in a much better spot. Is it perfect? No. We still have individuals that are in that pending queue that need to get addressed. But we are now producing more than what we receive, which took a long time to get to. And we are now, that is where we're able to really address the backlog that we have. But I will say that you'll see even substance use disorder professionals, we've had some trends, but overall, you're going to see consistency. So when you're putting in an application now, you are getting one of our better processing times. Thank goodness, if we have that application fully completed. So final approvals. So this is the rest of that story. So I said we left off in August. It was at that pinnacle, terrifying point where I was losing sleep because I had people starting to get sick because they were working so hard, and I needed to really help my team and get resources dispatched to do things well. And thankfully I did. And what you see here is the response. And again, a lot of us have gut instincts on things, but when we have data, it makes it a whole lot easier to go to your boss and say, I need a new position. And that's what I was able to do. And that's what leaders throughout all of the Office of Health Profession are being able to do when they're talking with their leaders to make sure that they're staffed appropriately and leveraging data. So again, speaks volumes. You can't argue with data. Well, people do, but we won't go there. So also for final approvals, this is just another graph to pull it out, but you'll end up seeing this is where we are at as of 1/3. Final approvals are under 30, which is something I am so proud of. They normally sometimes pop even below like 10. So we are really doing what we were designed to do for you all. Again, this is all of the professions in Credentialing Team 7. So I'm going to jump over to our licensed counselors. One thing that's interesting is Credentialing Team 7 has some of the, I'll say, lighter complexity. We've also ranked a lot of credentials based on complexity, and licensed counselors have a pretty good and complex package. They're very similar to psychology. We're having to verify education, credentials, supervision, and that takes time. And what you'll see overall, if I drew a trend line, we are still trending in the right direction. Is there more work here? Absolutely. But we're using the same tools to address the issues. And one thing I'm really happy about, we're going to look at where we ended at the end of the year. We are in a much healthier spot. And what I will say is graduation happens. So we ended up getting a pretty big influx where we had a lot of unique applications coming in, and we were able to process them in a new fashion. Approvals, again, trend line here. If I were to draw it, it's going in the right direction. And that actually, we do have trend lines on our scorecard where we're able to assess where we have problems just visually, keeping it simple for everybody. And our entire team sees our data every week. And that has been part of our success. Oftentimes you see your information and you're like, oh, I need to do something. And that automatically has a response, and it's not a punitive environment. It's a safe environment as we're doing this. We're not beating anyone over the head with data, but it's more like I have the information now to know where I need to focus. And that has been a powerful tool and resource. So what's next? What I will tell you is our credentialing a journey is we're only a year in from this. In March will be a year. And we've already made, I will say, just dramatic changes to how this process improvement works and continuous improvement. And we've just begun. We've got a lot more to do, but as you well know, we are in a new budget environment, different governor. There's a lot of different dynamics that we're going to be re-advocating for to make sure that we stay and hold this pattern. We also have another resource that has been dispatched, and that is called HELMS. And HELMS is our Healthcare Enforcement and Licensing Management System. We're actually going to be implementing this in February, if all goes well, and migrating to this system. What I will say is I've done several software implementations in my life, and I'm sure many of you have as well. Good and bad problems normally in your first year with a new software. So you can end up having great successes. You can end up having some setbacks. So I would just ask for grace in the process. But ultimately, this platform is based off of Salesforce. If any of you have used Salesforce, it is known for having great interfaces. Continuous improvement is easy. You normally just have to pay for it. So again, we have high hopes for this new platform. That you will have a better interface. You're already seeing a new interface as you apply for new credentials for the first time, and we hope to make that better. Our SAW account has been a challenge and confusing because I have 8 different SAW accounts for different things, and I don't know how to merge them. It is complex. So now we are getting something that is a little bit better, and we look forward to seeing what happens. So again, we're leaving Eilers and migrating to HELMS, and that's really the future. We are staffed right now to the right size, and we are really addressing the backlog. So that is where I'm going to leave us on credentialing. But if you have more questions tied to this, we are going to have an opportunity to have questions at the end of this presentation. Happy to answer anything that I can. I will say if you have any specific issues with credentialing that you're in right now, I would just ask that you personally email Claire and I. Our emails are at the end so that we can actually have a good conversation tied to that. So without further ado, I'm going to transition with another Slido. So if you want to get those cell phones out or join via a website, in one word, describe your experience applying for a credential. And you can be brutal. I don't bruise easy. The reality is the truth is what we need. Because I will tell you, I remember these things, and I have conversations in weird places. And I hope I don't have to testify this year, but more than likely I will. And things like what you share is going to help me because I can be frank with legislators of where we're really at and the importance. Frustrating, complicated. Thank you for that. Because it is complicated. It is. Yes. Slow. Yes. Overwhelming. Fair. Yes. Difficult. Yes. Delay after delay. I love that because I'm seeing it as I'm doing some master reviews because I normally get the oh no's that come to my desk, and so does Claire. And I hear the frustration. I will say there's one on Claire's on my desk right now that I'm grieving about because it's been almost a year. And we just got what we needed. And like I want to do a cartwheel for this person. We're rooting for people. We want this to work, and we are going to be getting it further in person. Thank you for that, because that's what I want to fix. That's something that's a core value. I don't want it to be impersonal anymore. It's a personal process. Gosh, your livelihood is tied to it. So we want you to know that the people making these decisions care, and we want to hear from you if you are struggling in the process. Long wait times. Yes, our clinicians are drastically long turnarounds are given. Yeah, when inquiring, and that has been our reality. It's going to get better. I will say that it's getting better, but we still have more work to do. Thank you for that. Well, Claire, I don't mean to pass it to you quickly, but here you go, my friend.
Thank you, Eve. I really appreciate all of that wonderful data to support some of the work that we are doing. I also love data. I don't have a lot of graphs or charts to show you because a lot of the rulemaking work really deals with legislative and regulatory language, which is really complex, and we're doing the best that we can to really make the rules more readable so that people understand what's required, and that can hopefully, and over time, make the credentialing process a little bit easier. I also want to apologize. I just got a huge blast of sunlight, so I am totally you're not able to see me or my facial expressions right now. Hopefully the sun goes behind a cloud or a plant at some point. But to sort of transition from our credentialing work into the profession support, the timelines that we have been able to reduce and the backlogs that we've been able to address in the last year have been outstanding. When I first started at the department at the end of 2023, I had someone who had been pending for 4 months and she hadn't even been contacted. There was a single person processing SUDP credentials. And what I was new to and was, not understanding at the time, because we were still separated back then, I couldn't reach out to the credentialing person who was processing that application. And today, not only do we have more than one person processing SUDP applications, but I have a group chat where I can immediately contact them. They can immediately ask me a question and get a response within seconds. So because of that, we have been able to dramatically reduce those internal delays that have caused additional delays with the processing of credentials. And not to give anyone false hope, but I have seen credentials issued in 48 hours when they're submitted completely, literally 48 hours from submission to issuing the credential. That's not routine for everybody, but we have that capacity now, and that is huge. So I won't read through all the numbers on this slide. You can see how much we've reduced that initial backlog down to just a handful of applications. But I do want to highlight that last point that these backlogs have been maintained at low levels, and we've been able to increase our support for the final approvals backlog. So we really are making progress with both getting the huge backlogs addressed and maintaining that over time, because we've been able to right size and get enough people handling this. Next slide, Eve. All right, so we have quite a few new professions that we've been implementing in part of these efforts, because I think it was a 2019 report that really started all of this work that identified how many members were needed in the behavioral health workforce, and we just didn't have enough credentials. So what the legislators did over time, they created first 3 new levels of those AACs, which Eve already addressed. They created a new profession, the behavioral health support specialist, that just went live a couple weeks ago. This summer, we'll see certified peer specialists as a new credential. Music therapists were just introduced this month. And the psychology associate was created in last year's legislation, and that will go live next year. So some of the themes of our behavioral health rulemaking were really identified during the listening sessions that 1724 required. So that really tasked the department with saying, we're just going to sit here and listen, and we want you to tell us the brutal, honest truth about your experience and how we can support you in staying in the workforce. What we heard, a lot of questions about continuing education and reducing that overall requirement. JP exams. Not every profession has a JP exam, but there was a lot of requests to move this from a certification requirement to continuing education. There were also requests to reduce some experience requirements for approved supervisors and the supervision required to get a credential. Implementing reduced application requirements for out-of-state applicants, or those endorsement pathways. That was also addressed in 1724, and the follow-up to that bill, House Bill 2247. And finally, when appropriate, to reduce those administrative burdens within the credentialing process, or as we might call it, the red tape of dealing with bureaucracy. Next slide. Some of the other retention challenges, which I'm sure are not news to any of us here in this call, wages. That's a number one concern that we've heard, that low wages are the biggest barrier to both recruiting and retaining individuals in the workforce. Reimbursement rates with managed care organizations do contribute to this. They have not been updated in years for some professions and some of the services provided by those professions. And the state room and board rates for residential treatment are abysmal compared to our neighbors. That low reimbursement rate, unfortunately, directly transfers into employee wages. With the low wages, we also have short staffing. It's really hard to keep an agency fully staffed, which causes a lot of burnout to happen because multiple staff take on multiple roles at the same time. And that burnout causes people to leave. In my work in the behavioral health workforce, I think I had 135% retention, which is really, really bad. We want to keep it at about 35% turnover. And it's really hard to keep people in a field when they don't feel like they get to have boundaries, when they're taking on too many responsibilities, and when they lack the support to do the job well. So one of the biggest issues that we're trying to address is not just making it easier to get in, but making it easier to stay and be healthy. We need a healthy workforce to do this work well. Next slide. So this current rulemaking that the SUDPs are implementing includes 3 different bills. We have 1724 from 2023, which you've already described. We have House Bill 2247, which was passed last year, and that implements some of the statutory recommendations that were identified during our listening sessions. Some of those include removing the limit on SUDPT credential renewals. They can now renew those credentials as many times as needed to gain experience, and permitting SUDPTs to work outside of a behavioral health agency, still under approved supervision. Finally, Senate Bill 6228 implements a lot of changes for substance use disorder treatment as a whole. There is only one tiny section that directly applies to the profession, and that is the most exciting part, which is a fee cap. So it implements a temporary fee cap of $100 between July of 2024 and June of 2029. And because of the way that our budget works in Washington, the legislature does need to vote to fund that at every budget session. So that'll be this year, and then again in 2 years, they would need to vote to fund that. As a side note, that funding did come from our opioid settlement dollars. I know a lot of professionals are curious about where that money went, and those decisions are being jurisdictions, but I do want to say some of that money did go directly toward that fee cap for SUDPs. So it is not money that we were able to receive from those settlements that just went into nowhere. It is directly helping our healthcare professionals. Our current timeline for rulemaking, we filed our CR 101 in April of last year, and then held 11 workshops between June and September to discuss the proposed changes and seek feedback from the members of the profession. The next stage of our rulemaking is the CR 102, and that includes filing the full proposed draft of the rule changes and conducting a significant analysis. And that is basically a dissertation that analyzes every single proposed change and does a cost-benefit analysis, as well as a discussion of any alternate frameworks that were determined. So this significant analysis is very lengthy. If you need something to put you to sleep, I would encourage you to read it before bedtime. But it does include a lot of the information that we sometimes can't go into detail about in these presentations. So if you'd like to read it, feel free to do so. We are currently in the public comment period for these rules, and we are accepting those comments in multiple formats. You can submit that directly online at our policy page. You can email me, or you can call and tell me exactly how you feel about all these terrible changes. We really do want to hear that feedback and pass it along. I think sometimes when you're out in the field, it really feels like your voice doesn't matter and that people don't want to hear you and make things easier. But I can tell you that from my experience in working with Eve and this work that we get to do, we really do want to listen and pass along those concerns. Our job is to support you and to make the system support you in the way that it is supposed to. So final steps after this. So February 5th, next week, we have our final public comment hearing. So we will officially announce these rules during a hearing, accept any testimony. Once that is closed, I will prepare the CR 103, which is our adoption phase. And this will essentially finalize that proposed language, implement any final changes we can that were submitted during the comment period. And these will be in effect at some point before July 1st of this year, which is the deadline that was included in the law. Next slide. All right, so some general proposed changes in these rules are to improve readability. So as I mentioned earlier, the WACs are not easy to read. You know, they're not something that anyone reads for fun. They're difficult to navigate. And sometimes you need someone to explain it to you in just normal language what it means. So what we tried to do in this particular rulemaking is make it easier to understand what the expectations are. So there's a lot of WACs that have been reworded, or there have been redundancies that were removed. We've tried to clarify expectations in a way that it makes it easier to understand what those expectations are. We've added in some new
Did Claire cut out for anyone else?
Yeah, I
Yeah,
lost
she
her.
cut out for me too.
No, not yet.
Let's try again. Can you hear me now?
Yes.
Okay,
Yes.
good. All right. So just improving readability in general, and making sure that the rules, one, can be read by anyone and understood, and two, they're not so redundant that they're confusing and creating more red tape. Some of the other general changes are to reduce administrative barriers. So we have updated language that certain degrees are considered to meet all of the education requirements that we have listed in rule. SCDPs are a little unique as a profession because we don't just say you have to have a degree. We say you have to cover these 23 specific topics in the context of recovery. And that requires a very detailed administrative review in our credentialing team. So we essentially created some ways to leapfrog that requirement because we know that certain degrees cover all those topics. That can drastically reduce the timeline for credentialing. We've also clarified the examination and application process to make it a little bit easier for folks to understand what they're responsible for and what their supervisor is responsible for and what their school is responsible for. We also clarified supervision standards and reduced the number of hours required to be an approved supervisor and clarified the structure for trainee support for credentialing. And that's a big one because in my work in the field, one of the biggest barriers and causes of burnout was not having enough supervisory support. And I'm sure many of you have heard of the trial by fire, where you just get tossed in at the deep end. If you don't swim, people leave. And that is how a lot of programs are set up. We are trying to ensure that no one entering this workforce gets tossed in without support. And hopefully with that support, they can learn from learn as they are supposed to from their approved supervisor in order to stay in the field in a safe and sustainable way. Next slide. So one of my biggest considerations in doing this rulemaking was also to consider why we had such a high fee to begin with. And for those of you who don't know, before the fee cap, SUDPs had an initial application cost of $555 and a renewal cost of $300. And this has been high for many years because statistically, SUDPs are consistently in the highest third of disciplined professions. There's many reasons or potential causes that contribute to this. But one of the goals that we have is in order to reduce this fee long-term and without additional funding, we need to reduce these disciplinary rates. And that means we have to increase our ethics and increase the expectations for behavior. So we created a new rule in these SUDP rules that clarifies the ethical conduct that's required for SUDPs and trainees. So every person in this profession is required to follow an industry recognized code of conduct. That could be the NADAC Code of Ethics, the NASW. We clarified language about prohibited conduct, for example, boundary violations. This is one of the #1 boundary violations that occurs with SUDPs and trainees from people who maybe perhaps genuinely, innocently don't understand they can't have a relationship with a patient. For all behavioral health professions, providers are completely prohibited from having a relationship with the patient, even a friendship. This was not clear in the rules before. It will be clear in the new proposed language. And it also requires approved supervisors to talk about this code of ethics with each SUDP trainee that they supervise. We hope that this is already happening, but it is now required in the rule. So this is not something that will just be a hope, it is a requirement. Next slide. So we also had a lot of clarifying language in the SUDP trainee certification standards. And I do want to call out that in rulemaking that is designed to reduce barriers, this particular rule change might seem like it's increasing barriers, but I hope to explain the intent here. That SUDPTs have one of the lowest barrier credentials that exist in Washington. There is no education requirement, there is no experience requirement. The only requirement now is that they work under an approved supervisor because they now are not limited just to the BHA setting. This means that anyone could apply for a credential without having any training whatsoever and start working as a trainee. This is not good for somebody who needs education and supervision and support to do this work. So some of the small language changes require that someone be currently enrolled and actively completing coursework. That means they didn't just send an email to a school saying they're interested in the SUDP program. They're enrolled, they're completing the work, they are learning how to do the job while they are working in the field and getting that work done. This also clarifies that trainees cannot practice on a pending credential. Practice on a pending credential has never been permitted for this profession, but there are some individuals who were confused because there was no language explicitly saying that in the rule. So we included that new language so that people understand that expectation. We are also requiring a 4-hour training in ethics and law for SUDPTs prior to initial certification. I don't know about you, but when I was a manager and was hiring people, I looked for folks who had that ethical support because working in the field, it's very difficult to jump right in and serve patients without having an understanding of what the ethics and boundaries and what the law requirements are for healthcare providers working with patients. Finally, we are requiring verification of that education enrollment and supervised experience for annual renewal. And this is to ensure compliance with the supervision and education requirements. Trainees do need to work under supervision because it is such a low barrier credential. And now that they can renew that credential indefinitely, there were many, many members of the profession who were concerned that if we did not have some documentation of this work, that someone could work for 10 years as a trainee and never complete a single class. So this requirement just helps assure that somebody is working toward that education or that they've already completed that education. There's not a full-time enrollment requirement. So if someone really wants to take it slow and do 1 class a quarter or 1 class a year, that's fine. We just require that they are currently working on that while they work as a trainee. Next slide. All right, so our out-of-state applicants, Eve mentioned this a little bit in her piece. The intent here is to implement changes to support applicants who have out-of-state experience and or qualifying out-of-state credentials. So we did a couple of proposed rule changes here. First, to create the path for out-of-state credentials that have been evaluated to have substantially equivalent licensing standards. For these individuals, if we can get verification of that qualifying out-of-state credential, we can immediately issue. So that's a good example of the folks that can get issued within 48 hours. It also allows us to waive the requirement for applicants to submit supervised experience if they've held a credential as an SUD counselor for at least 1 year. So this is what we might call the endorsement pathway, where if we do have an applicant who's passed the exam and has been working as a counselor in another state for at least 1 year, it's possible that their state is not evaluated to have substantially equivalent education standards, but then they are only required to submit that documentation of education. We do not need their previous supervisor, potentially from 10 or 20 years ago, to then sign off on new supervised experience. Next slide. All right, so as I alluded to earlier, supervision standards are one of the measures that we looked at in terms of improving retention. When you have a good supervisor, that can make or break someone's decision to stay in the field. And now that individuals can work outside of BHAs, there is no longer that state license structure that BHAs have in every setting where a trainee could be working. So what this seeks to do is absorb some of those supervision requirements that are found in BHAs and create them as a specific profession supervision requirement for trainees in any setting that they're working. So these proposed changes firstly require the trainees to complete at least 10 hours in 3 specific topics as part of their first 50 hours under direct observation. So this intends that trainees are being observed doing at least 3 of the different main tasks of trainee work. They're not spending their first 50 hours only doing assessments and then leading a group before they've ever been observed leading a group counseling session. The new requirements also ask for weekly supervision between a trainee and their approved supervisor. This can include group or triadic supervision so that trainees can have that group opportunity with their supervisor. And it requires trainees and their approved supervisor to complete a 5-part plan, which includes the review of ethical standards that I mentioned earlier, clinical development goals, a review of their academic progress toward SUDP certification, identifying an alternate supervisor, and identifying the appropriate trainee to client ratio. And this last item, I will say, came at the request of many trainees who had contacted us saying, why isn't there a ratio somewhere in the rules? This is my 2nd week on the job and they assigned me 60 patients. And we don't want to impose what we think the ratio should be because that's really a determination based on what the supervisor and trainee discuss. Someone might have a lot of experience when they first get hired and they can handle a high ratio. Others need to be able to work up so that they can adequately and appropriately support all of those patients. Next slide. All right, and for the supervision standards, as I mentioned, we are requiring approved supervisors to have less experience. So this requirement went from 3,000 hours, which is about 1.5 years, down to 1 year as a fully certified SUDP. They also now have to complete an 8-hour training in clinical supervisor training before or within their first year providing supervision to SUDP trainees. So the goal of this, firstly, we made it a requirement. It is no longer optional. But we did try to have some flexibility to allow that training to occur either before they become a supervisor or in their first year, so that if there's an urgent need in some facilities, someone could step in as a supervisor and take their training a month or 2 in. Finally, we are permitting remote supervision of trainees after the first 50 hours have been completed. So under the prior rules, even during the pandemic, SUDP supervisors were required to be physically on site where their trainees were working at all times. And as things changed during the pandemic with mobile crisis response units or mobile SUD teams, what we were really hearing from the facilities is that once someone has their 50 hours completed and they can call their supervisor on the phone, it really makes sense for them to be allowed to have that remote supervision. So that is the final change to support the work that's being done in those facilities. I will add here that a lot of the members of the profession were not supportive of reducing the experience requirement for approved supervisors. What we heard over and over again is that 1 year is not enough. You need more than 1 year at working in this field in order to be a good supervisor. And what this graph shows is how many SUDPs we currently have that are licensed by the age of their license. So as you can see, this rule change is going to support at best about 100 people. And those 100 people are going to be impacted in a lot of the facilities that do not have extra SUDPs around or SUDPs with a lot of experience. So it is a small number of people, but impacting a bigger number of facilities in areas that desperately need those services. The vast majority of SUDPs who are providing supervision have not only more than 2 years of experience, but about half of them have more than 10 years of experience. So we are not flooding the field with inexperienced supervisors. We are supporting supervisors in the work that they are doing in communities that critically need this work. So our continuing education requirements did also get significantly reduced. Our proposed changes reduced the overall CE requirement by half, from 40 hours every 2 years down to 20 hours. That can include up to 4 hours of professional development activities. We also clarify what those qualifying activities are. And one of our exciting changes is to support the legislative process and engaging with the profession at a regulatory level. So members who participate in rules hearings for bills that impact SUDPs, people who attend our SUDP advisory committee meetings, are able to count those hours toward their professional development. And that's up to 4 hours per 2-year cycle. Finally, in my attempt to reduce the red tape, we got rid of a lot of redundancies in the continuing education rules and clarified exactly what hours are required in those cycles, which were the suicide assessment, which is 3 hours every 6 years, 2 hours in health equity every 4 years, and 4 hours in law and ethics every 2 years. So as you can see, having 3 different requirements with very different numbers, it can be a lot to keep track of. So we tried to clarify this language and make it as simple as possible so people understand what those requirements are. Some of our additional proposed changes, I mentioned a few of these already. We are allowing applicants with the qualifying degree to meet those requirements in our education WAC. We implemented that temporary fee cap. We also clarified some rule language for our SUDP apprenticeship programs and what those application processes look like. Clarified that trainees who are apprentices may need to complete 4,000 hours of supervised experience to qualify for certification. They need to complete the entire apprenticeship, which does require that 4,000 hour limit. We usually only require up to 2,500 for non-apprenticeship applicants. So that rule looked a little confusing without the clarifying language. And finally, now that trainees are outside of BHAs, we are requiring SUDPT disclosures to include their approved supervisor's name, credential number, and contact info. That way, the client is able to contact the approved supervisor, who is still legally responsible for all patients of an SUDPT. Next slide. All right, so what is next? We are looking forward to more changes in 2025. We are concluding our permanent rulemaking by July 1st of this year. HELMS will fully roll out by the end of 2025, which will hopefully make our credentialing process much simpler and smoother. And we will see what the legislators have for us. We are currently engaged in the long legislative session, and we expect to hear about behavioral health legislation impacts as well. So it is very possible that by the end of April here, we'll have a much better idea of where behavioral health is heading in this state. So our final Slido for today, after hearing all of this word vomit information about regulation, if you could change one thing about the behavioral health workforce, what would it be? You know, there's so many different ways that it impacts people in their different roles. And in your specific role, what would you change if you could? What have we missed? Or what are you excited about changes? Or what changes are you prioritizing in the future? I love this. Free therapy for behavioral health workers, reimbursement, much higher pay, absolutely. More facilities, funding for supervisors. More access, yes. Continued development of additional certifications, such as the behavioral health support specialist, absolutely. We are just at the beginning of the BHSS work, and there's some exciting places we can go. Danielle, I do see your question. Is there any potential for grandfathering for professionals that have been licensed and in the field for decades? Both yes and no. It kind of depends on the profession that you're interested in or what experience you'd like to apply. If you'd like to talk offline about your exact situation, feel free to contact Eve and I, and we can get you connected with the right person if it's not one of us. And I will also put our emails in the chat. All right, and Danny, do we have time for questions right now, or I'm not sure. I think we went over our time a little bit, so I'm not sure what's next.
Well, let's take this question from Angie and then move on after that. But we will have some time at the very end to circle back and answer any additional questions that come up. So Angie said, you mentioned an effort to transfer credentials from other states. Does this include continuing education that is in progress?
That's a great question. So in the SUDP profession and BHSS, which are mine, we don't have any location requirement for CE to take place in Washington. So our definition for CE is that it's from an industry recognized source. And we have some examples of what that could be. Usually those are national associations. So it is very, very likely that CE done in another state would qualify. You'd have to check the profession specific rules, but I can help walk you through that if you have other questions.
Wonderful. Well, with that, I hope you'll join me in thanking Eve and Claire for the wonderful information that you've shared. I know this gives me a lot of hope for these credentialing process improvements and the future state of the field with additional SUDPs and beyond. So thank you so much for your time today, and we really appreciate it. And with that, I will go ahead and introduce our next presenters. So next we have a group who are all here with the Washington State Healthcare Authority, and they are going to talk to us about the Start Your Path campaign. So we have Melissa Temke. Melissa is the Behavioral Health Communications Manager at the Healthcare Authority. She is passionate about overseeing initiatives that help the people of Washington access behavioral health services. In her spare time, she enjoys spoiling her French bulldog and hanging out in her yard with her husband. And joining Melissa will be Todd Jensen. Todd, when he's not working as a behavioral health workforce analyst for Washington State Healthcare Authority, he is exploring new bicycle routes around the state and planning his next backpacking or camping adventure. And finally, we have Deb Warren, who's joining us. Deb Warren is the Multicultural Marketing Manager with Quinn Thomas, which is a Pacific Northwest-based marketing communications agency that works with an array of regional clients in healthcare, workforce development, and more. In her spare time, you can find Deb replicating recipes from her childhood in Hawaii or checking out local art exhibitions. And with that, I will turn it over to our wonderful team, and just let me know when you are ready for me to advance the slides.
Okay, thanks, Danny. Okay, hello everyone. My name is Todd Jensen. I'm a behavioral health workforce analyst with Washington State Healthcare Authority. Before coming to the Healthcare Authority, I worked in behavioral health for almost 20 years in a variety of roles. I'm joined by my communications and marketing partners who support and help me with the Start Your Path campaign. Today we're going to be talking about the work we're doing. So Danny, you can go to the next slide. So as you know, there are workforce shortages across the healthcare industry. Today, we'll be sharing our efforts to recruit across the behavioral health field to meet the unique needs within Washington State. Workforce shortages across the board is a complex issue. So we developed this campaign to raise awareness of and interest in behavioral health careers. This is a multi-phase campaign, which was initially launched in 2021. Key components of this campaign is to centralize resources. So if you're interested in this, you can go to startyourpath.org. The campaign also aims to increase representation and inclusion by highlighting real Washington behavioral health workers across the state. The website, as well as the entire campaign, is developed in English and Spanish to help with recruitment of bilingual providers. And Danny, go to the next slide. So there is a vital need for behavioral health providers in Washington State. Similarly to other healthcare providers, there is a growing need for these professionals. Furthermore, people of color represent less than 20% of the behavioral health workforce. However, research shows that patients experience better health outcomes when you're connected with a provider who has a similar cultural and ethnic background. And then, well, you can go to the next slide, Danny, and I'm going to pass it to my coworker, Melissa.
Oh, Melissa, I think you're muted.
You would think 5 years after working from home, I would understand to mute and unmute. So thanks, Todd. So this campaign started in 2021, and the very beginning of this campaign was really just letting people know there are so many different types of behavioral health careers out there. When people sometimes think of a behavioral health career, they think psychologist or they think counselor, but there's peers, there's SUDPs, like was talked about, there's prevention. So it's really let people know that there is a huge role of behavioral health careers available, and then make them go somewhere to learn more about it. So we created this great website, and we did a couple of ad buys, and we got people interested. And then phase 2 of this campaign started in October of 2022. And it was basically, let's keep talking about it. Let's keep talking about this. Let's keep talking about the opportunities. Let's keep bringing people to this website. And we were finding that we were getting more and more interest and more momentum, but we wanted to find out what was happening with that. Are they just learning and then doing nothing with the information, or are they actually going forward and getting and starting to think through that process, or even changing careers, or looking at potentially going back to school? Then phase 3 started in June of 2023. Again, it was continuing awareness, really starting to engage people. So I believe this was when we developed a quiz on our website, startyourpath.org. If you haven't, I encourage you to check out the site. It's a really fun quiz. It just asks you a few questions about where your interests lie, and kind of gives you ideas of what behavioral health careers would be great for you. And then it tells you kind of how you can start that work. Then in October 24, we were expanding the awareness. We started using some influencers. We started doing some day in the life videos. And then we're really trying to drive engagement. And we're starting to see people are really engaged in the website. People are really engaged in the videos, but we'll talk about that as we go on with some of our numbers. So go ahead and go to the next slide. So some of the key components of this campaign are really, our goal was to reach individuals who were maybe not in the workforce yet, or not sure what they were going to do in the workforce. So that 18 to 24 age, maybe they're in college, maybe they're not in college. And then also those individuals who were unemployed. This campaign started in 2021. So like right at that weird transition where people were starting to get vaccinated after COVID to some extent, but people were maybe thinking of wanting different careers. Self-care was talked about a lot. So those people who were maybe transitioning out, maybe they were in the service industry, who knows, and they wanted to do something differently. We also wanted to reach people with lived experience. So we have tailored our messaging for really, I think it matters if people really are in the workforce. So we really focus on finding people who actually are in the behavioral health professions. And those are the people that do our videos and our day in the lives and things like that. And we wanted to have a geographic diversity. We know that rural areas need more behavioral health providers, but we also wanted to target those urban areas as well. And we wanted our audience to be really inspired and really feel like, oh, okay, I can do something. I can make a difference here. So we have this great website, and that's a central location. It's one place you can go and you can learn all kinds of things about behavioral health. You can learn about what kind of careers are available. You can learn about how you can get into those careers. You can learn about how much you can expect to be paid, sort of as a general guideline. You can learn about what kind of certifications those careers take. And then we are really doing an integrated marketing approach overall. So we are we're trying to reach our key audiences. And then each year we look at our numbers, we do a lot of reporting, we really look at our numbers and we go, okay, we're getting more hits on LinkedIn, so we're going to move over there. We're getting a lot of videos that are getting watched, which ones are getting watched more than others. And we found also we've started to do some in-person events, and those are extremely successful. We went to Yakima Community College this past year, and basically did kind of a meet and greet and learning about behavioral health fields. Go ahead and go to the next slide. Okay, and I believe Deb is going to talk about this. Yeah, go for it.
Yes, thanks so much, Melissa.
Yeah.
And I see some great questions in the chat as well. I think I'll answer some of those during this, but please feel free to chime in once we've wrapped the presentation if you have additional questions that I haven't fully covered throughout some of these sections. So as Melissa mentioned, my team at Quinn Thomas has been working really closely with the Washington State Healthcare Authority since the inception of this campaign. We're really proud of the different iterations we've been able to deploy. And one key component here as well is career decisions, as many of us know, take a long time to make. It oftentimes takes us seeing something multiple, it oftentimes takes us seeing something multiple times before we maybe consider taking the next step. And so that's also part of why this has been a multi-phase campaign as well. If you can imagine, maybe you're a high school student who's recently graduated, you're trying to figure out what you want to do. It may take seeing an ad, hearing from a friend, going to an event before you possibly start to explore a career. And even then, it may take a while to pursue education and then credentialing before you actually join the field. So this is, from our perspective, a really long-term initiative. And as many of you all are familiar, especially in workforce development, it's very much a marathon and not a sprint. But we wanted to just touch on a few highlights from this most recent phase. So as Melissa mentioned, we've really sought some new ways to really engage statewide audiences and to also expand awareness of behavioral health careers. So while we do have our digital online campaign, which was invested in because we know many of our audiences, particularly our younger audiences, are spending a lot of time online, we also wanted to try to take this a step further and really get folks to engage even more. So as Melissa mentioned, we've this phase explored some influencer partnerships, and I saw we had a great question here. Happy to share some links after this presentation, but we know that through our research, the earlier that we're able to get in front of folks, the better. And oh, sorry, you can actually, thank you, Danny. The earlier we can get in front of folks, the better. And so when we're thinking about that, we wanted to partner with influencers who are also, particularly among our younger audiences, kind of our Gen Z folks, their peers are actually one of their most trusted and relied upon sources of information. So partnering with influencers, we thought was an interesting way of trying to reach that audience. So we partnered with a licensed mental health counselor in Western Washington who could really speak about their experience as a professional and what drew them to this career. We also partnered with a student athlete in Eastern Washington. It was actually the first time we were able to engage with someone who has received services themselves and could actually speak to the value of these services. And so it was great to see a mental health advocate and then also working with someone who's actually in the field as well. So I think as we're thinking about expanding this in the future, we'd love to continue leveraging some of those influencer voices. We also wanted to include a few other highlights that you all might find most relevant from Central and Eastern Washington. And so Website sessions are a key component of the campaign. We're really tracking closely how many folks are coming to the site, where they're going, what they're engaging in. And we're oftentimes thinking about what cities we're seeing most of our traffic from. And so at a high level, about 15% of our traffic is coming from Central and Eastern Washington. And some of those high traffic areas include Spokane, Kennewick, Spokane Valley, and Wenatchee. As Melissa also mentioned, we're always looking to optimize the campaign though. So as we're looking at the remainder of this phase, which will wrap up at the end of February, being very intentional about even further engaging with our Central and Eastern Washington audiences. So geo-targeting, essentially serving ads where we know our communities are spending time, so that we can hopefully continue to increase the number of folks that are seeing our ads, but then also going to the landing page to get more resources. Additionally, we also are doing more place-based ads. So that looks like, if you might be in transit, you could see an ad on a bus, or in this case, as we're thinking again about some of our younger audiences, particularly those who might already be in higher education or pursuing a degree, we did quite a few college-based ads. So across statewide, you might see ads like these in kind of the second column. In Eastern Washington in particular, we've got some placements at Gonzaga University, Washington State University, and Central Washington University. And all of our ads allow folks to, if they're walking by, scan a QR code and then go to the website. So it's really easy for them to explore further. And then, as Melissa mentioned, we were really excited to partner with the Yakima Valley College to pilot one of our first in-person events to invite folks who are currently in the field to talk more about their career and what this looks like. We were fortunate to have 80 students, both high school and college age students, attend, and 92% in a post-event survey said that they were interested in a similar event in the future. We also did an in-person event in Western Washington. We actually worked with the Washington Health Occupation Student of America, their fall conference in Western Washington, to really get in front of college age students and talk more about these careers and offer these resources. These were really successful in terms of, again, getting in front of folks early on as they're considering what their pathways look like. And so excited about in future phases how we might be able to continue partnering with regional organizations as well as institutions across the state that are already serving these students and helping to raise awareness again of these careers. And I think we can go on to the next slide. Great. I think these videos might play, that can be a little finicky, but before they possibly do, I just wanted to note, working with behavioral health professionals has really been key to the campaign as a whole. We have worked with professionals across the state, from Vancouver to Bellingham, Pomeroy, Yakima, Spokane, across all of the different titles that we had noted in a previous slide, really to tell their stories about why they joined this field, how impactful it is. And so if these do play, you'll see an English testimonial, a Spanglish testimonial, so really trying to resonate with some of our bilingual audiences, and then an example of a user-generated style video, which is just a fancy way of saying a more organic feeling video that someone could have captured on their own phone and then posted online. The more authentic it can feel, I think it even better resonates with our audiences who are very used to seeing their peers capture content and put it out themselves online. So Danny, if we can try to play these, that'd be great. But if the audio doesn't work or whatever.
I just like helping those who may not have the same opportunities I had, having 3 meals a day, a graduate of high school, college student. I had these opportunities that a lot of people didn't. So if I'm able to help them on that path that I had, then I definitely want to do that.
What I find most rewarding about being in the behavioral health field is to touch someone's life, to be that person that can listen, care, and promotes improvement that they want or need. Como proveedora bilingüe, español e inglés, puedo ofrecer servicios en la lengua materna del paciente. En múltiples ocasiones no hay forma de que la persona traduzca cómo se siente por dentro. Ofreciendo servicios en su lengua materna, promueve expresarse abiertamente y a usar sus propias palabras.
Great, thank you. So that's just a snapshot of some of the videos that we've helped to develop for this phase. And you all may actually see them out in the world, on social media, online, especially after hearing our presentation today. You might start to see these. So with that, I will turn it back over to Melissa, and I think we can advance the slides.
I just like helping.
Thanks, Deb. So I touched on this kind of earlier, but as we have continued with this campaign, we have seen better and better performances. So we have almost 200 million impressions. So what an impression means is it's the total number of time a content was displayed. So you're on social media and an ad pops up, that's considered an impression. What this means is it tells us the number of times that our ad was potentially viewed by an audience. So it doesn't mean that they clicked on the video, it doesn't mean that they watched the video, but they saw it. And then we had almost 32 million video completes. So that's huge. That means that the video popped up and they clicked on it and they watched the entire thing. So that's the total number of viewers who watch an entire video without skipping. And that means that they were engaged and they were interested in the video. They didn't accidentally click it and go, oh no, I don't want to see that. They actually wanted to watch it. And then we had almost 350,000 web sessions. So that means that the number of times somebody was directed to a campaign site and they watched a video and then they went to the Start Your Path site. So that's huge. So they saw an ad, they were interested, they visited the site. And I don't know, Deb, if we have a way of telling who takes the quiz or not.
Yes, we do.
Okay.
Yes, I can actually, if you give me a moment, I might be able to pull up the exact number. But I will also note, apologies for the typo here. This is updated as of December 2024. And so these metrics are basically from the start of the campaign through the end of last year. And so it's exciting to see, these metrics that we've been measuring since the beginning, but I'm happy to pull up the quiz number and I can drop that in the chat.
Okay, I was just kind of curious. Thank you. Go ahead and go to the next slide. Okay. So things we have learned in 4 years of doing this campaign. It really matters that you have real, authentic, and diverse stories. I've been part of campaigns in the past where we actually hire actors, and especially with a campaign like this, where the goal of the campaign is to get people to either decide on a career or to even change a career. You really need authentic people who are engaged and already doing that career to help people make that choice. You also need one place for people to go. People don't want to have to go to one place to find out what education they need to switch careers, and then go to another place to find out how much that costs and how they enroll, and then another one to find out, okay, if I go through all this time and effort, what kind of salary am I going to have? So that's why we really focused on putting all of that information on one spot. And then getting in front of your audience as early as possible. That's why we really focus on that 18 to 25. So we're getting those kiddos that are graduating high school. Maybe they're going to college, maybe they're not going to college, but we're putting it in their heads early that maybe you want to pursue a behavioral health career. Go ahead and go to the next slide. Okay, so I think it's going to go back to Deb or a research team. And we're going to talk about some research insights.
Yes, thank you. For all intents and purposes today, I will be a one-man research team, so please bear with me. I will also do my best to answer any questions related to the research, but we did work with professional research partners who do qualitative and quantitative research across the Pacific Northwest. And so if you all have specific questions that I'm not able to address here, I'm always happy to help follow up afterward. That being said, to inform this entire campaign, the Washington State Healthcare Authority invested in both qualitative and quantitative research. So qualitative research for this included focus groups with English and Spanish audiences across the state who were either job searching or looking for a career change. That qualitative research also included one-to-one interviews with folks from across the state who are really career connectors. So thinking about career counselors, for example, at different colleges across the state. So we engaged with both folks who are trying to reach and then individuals who are already working with students to really understand what they were looking for, what kind of creative and messaging resonated with them, and then also if there might be some new opportunities that we hadn't thought of or should be considering as part of the campaign. Additionally, we invested in quantitative research. So we'll actually be touching on that here in a moment, but this really looked like a statewide survey of workforce age individuals in Washington, so about 18 to 60, to understand folks' awareness of behavioral health careers, potentially perceived barriers to entry, and then overall awareness with the campaign. I think one of the values there is because this is such a long-term adventure for folks when they're thinking about their careers. Even if someone sees an ad today, it may be a year or two before they actually join this career. So this survey pre-phase 4, and then actually we'll conduct one more after we wrap up, is also intended to help us really understand how much of an impact this campaign has had on statewide audiences in data that's more apples to apples comparable, that goes beyond some of those marketing insights that we've been able to leverage to date. So today we'll briefly touch on some of the survey findings and then some opportunities we identified for workforce development. So we can advance to the next slide. Great, thank you. So excuse me, the statewide survey we conducted actually occurred in September of 2024, so fairly recent. It went out to, we engaged 600 Washingtonians, again, who we identified as workforce age. Here's just a brief breakdown of some of these participants. So we work to ensure equal representation across the state. About a quarter of our participants were from Eastern Washington as well as Western Washington, and then thinking about some major areas in those areas of the state as well. We also work to have urban, suburban, and rural representation that more closely mirrors the demographics of the state as a whole. And then from folks who are researchers through different research methods identified as maybe career changer or someone who feels underemployed. We saw many of the same findings in our survey as we did in our focus groups, that individuals were likely coming from retail or food service, possibly an adjacent healthcare career, or even childcare. So that's these kind of top 4 current or previous industries of employment. For those of you who have been in this field or recruit in this field, you've likely seen similar trends. And so this is also something we've been keeping in mind as we're thinking about our folks who are maybe that 25 to 44-year-old range who aren't necessarily as early in their career, but still looking to make a change and considering a new field like behavioral health for that change. And then in the next slide. Awesome. So for the sake of time and digestibility, we distilled some of the key takeaways from the survey. Again, we had asked folks about their awareness of behavioral health careers, perceived barriers, and then also awareness of the campaign. But for you all, we again wanted to distill down a few insights that you might find most valuable. These are things that we're thinking about and also applying to the resources that we're thinking about for the website, as well as how we're thinking about the evolution of the campaign. So one initial barrier we heard is fear of burnout and caregiver fatigue. I'm sure many of you have heard this or even potentially experienced this yourself if you've been in this career. I noticed in the last presentation, some folks said that there should be free behavioral health services for behavioral health providers. And so I think, this insight very much aligns with that concern. As we're looking even at our younger audiences, this was anecdotally something we were even hearing in our focus groups of how do I maintain my own mental health? How do I take care of myself so I can take care of others? And so as we're thinking about this, our team's continuing to try to highlight as much as possible through different testimonials, what our current professionals are really doing to maintain their own mental health. That's something that we tried to bring through in our testimonials for this phase and will continue to do. We're also consistently updating the website with resources. And so, trying to provide as much information and support as possible online that can really help folks understand what resources are available to them. So something to consider as you might be doing similar efforts or engaging in similar conversations in your work. Additionally, one other potential barrier that we identified is the Washington workforce, folks in Washington's workforce think enrolling in education is really the next step they'd need to take to explore to join this field. But the cost of credentials or education is a primary concern. I think that the Washington DOH team did such a great job today of explaining some of the work that they're already doing to try to simplify and streamline credentialing and in careers as much as possible. And I know that there's many folks who are consistently working on simplifying this as well. So as we're thinking about how this might apply from a marketing communication standpoint, one of the things we've been prioritizing is really trying to increase awareness of roles that maybe don't require as much credentialing or education, or trying to communicate to folks what the minimum education requirement looks like to at least get started, and then to explore what the full pathway looks like on the website. Oftentimes when someone is so early on in their career or in a career decision, it's a little overwhelming to see all the credentialing and all of the education. And so we've been really intentional with how we are sharing just kind of bare minimum information initially to get folks interested. and then thinking about what is most critical for folks to see on the website, and then really trying to think about that user experience overall. And how that might apply to your work is I think continuing to think about what roles or careers might be available with your organizations, or that you might be recruiting for, that don't require as much credentialing, and trying to utilize that to entice folks initially to be interested in this field, and then they can of course explore further what advancing in that role looks like, or how they can maybe take the next step in a specific role. So with that, I think we just have one last slide. Just in case folks have any questions, or looking for more information or resources, here is the best way to contact the entire team that is supporting the campaign, and always happy to help answer questions during this session as well as over the chat. I will be dropping in a quick stat here in the chat in a moment, so I'll pause there for any questions.
We do have a couple of questions in the chat that I'm going to circle back to for the team. So Michelle asked, how did you engage the academic institutions to support these efforts?
Well, I think I could take that one. So one thing I worked with the State Board of Community Technical Colleges, um, some, and then also, honestly, Dan Ferguson. He's kind of my go-to for any sort of higher education stuff.
I'll also highlight, in addition, we also in the research conducted most recent in this last year, we're really intentional about engaging folks who are, at different schools already, counseling students on careers and what options are available to them. Part of the reason why we included them in research is we know folks in this space are generally in workforce development are extremely busy, and can be really challenging to kind of nail down. And so we wanted to be really mindful of their time, and participants in as a standard practice for research. Folks who are engaged for research are compensated for their time. And so that was also another way that we were able to do more one-on-one interviews with folks at different educational institutions, and again, get all of their valuable insights, apply it to our work, and make sure that they were also getting something out of that as well.
Great, thank you. And then are you able to share, Carla asked what influencers, are you able to share the names of the influencers that you worked with?
Yes, I'm actually happy. I will send links to both posts. I think, yeah, I'll send links to both posts so folks can take a peek.
Phenomenal. I'm so grateful to hear so much wonderful information. Both of these presentations just give me so much hope. So I really love this campaign. We do have some time now for any additional questions, either for the Healthcare Authority team or the team from Department of Health. If anyone has any additional questions, we can circle back. We'd love to facilitate those at this time. So I'll pause for questions. Okay, so if you do have any additional questions that you'd like to reach out individually, the contact information for that's included in the presentations will be sent out following today. We'll send out that contact information along with the slides from today. And we just want to thank you for attending today. If you additionally, in addition to the presenter contact information, you can reach out to me via the this contact information, which I realized I neglected to introduce myself earlier. My name is Danny LaForce. I am the Workforce Development Liaison with Greater Health Now. So happy to coordinate if you have any insights into learning collaboratives or topics you'd like to see discussed. Or you can also include those in the chat, in the survey that we have. I'll put the link in the chat now. It's a quick few-minute survey to give us some feedback about the learning collaboratives and anything you'd like to see in the future. And there's also a QR code here as well if you'd prefer to fill it out that way. But as you do take a moment to give us your feedback, I hope you'll join me in thanking once again our presenters. We really, really appreciate all of your efforts and time and energy and the wonderful, phenomenal information that you shared. Thank you, thank you, thank you. And thank you everyone for participating and attending today.
Thank you so much.